And in Assam, with COVID numbers spiking in rural areas, the state had relaunched its community surveillance program that paid off in the first wave and could turn into a game changer in the second. NDTV's Ratnadip, Choudhury and Sanjay Chakraborty report from a remote village in Kamrup district to find out how this intensive village-to-village survey finds positivity rates only marginally higher in villages than the state's average positivity rate.
Asha worker Kanika Rabha and nurse Rashmi Kachari are going door to door in Zimiri Gaon on the Assam-Meghalaya border, tasked to screen over 400 people in the village for COVID symptoms. Monitoring people in home isolation, checking oxygen levels twice a day. These rural health workers also dispel fears about COVID.
Sir, mane prothom jitia mane eritu ahisil ita to amak phoye lagisil diason tothapio ami mane phoi tu mane bhaba nasilo karon ami itu mane kuribo loga kam boli ami aguai gisu kintu itiak loke kuri aso tothapio phoi tu sar subore ase mane phoi tu lagie diason tothapio raije mane bhale thakok দায়িত্বৰ কি মানে যিটো প্ৰগ্ৰামত যিটো মানে আমি কৰি যাব লাগে সেই মতে আমি আগবাঢ়ি যাওঁ যে ইটো এসিএসপি প্ৰগ্ৰামটোত মানে বিশেষকৈ এয়া কপ কল কাৰ হৈছে জ্বৰ হৈছে ডায়ৰিয়া হৈছে ইবিলাকে আমি ভালদৰে হুঠো মানুহখিনি হুঠাৰ পিছত তেওঁলোকে যিটো হৈছে আমাক কয়.
Like Zimiri Gaon, Assam's 26,000 villages will be surveyed under the community surveillance program. Run by the rural health workers, the initiative got results in the first wave of COVID last year and was relaunched this June when remote areas reported a fresh spike. These healthcare workers are the foot soldiers of Assam's battle against COVID in the rural areas. They go to every household looking for people with symptoms, test them, and also try to find out if there are people who are suffering from diarrhea, malaria, or Japanese encephalitis, which hits Assam every year. Besides the ASHA worker, each surveillance team has a nurse, a doctor, a lab technician and a paramedic, and the results are showing. Till June 17, 1 crore 88 lakh people of Assam's over 3 crores population have been surveyed already. Nearly 24,000 of the 26,000 villages in Assam were covered in 15 days. 7,75,000 villagers have been screened. 2,93,000 COVID tests have been done at the village level. And most importantly, over 9,000 positive cases have been identified so far from the villages surveyed. The villages surveyed have a positivity rate of 3.24%, marginally higher than the average positivity rate of the state at the same period, which is 3.05%.
We have a rapid response team consisting of 3 or 4 members like that. If anyone is having problem or fever or breathing difficulty, they used to inform ASA first of all. After that, ASA used to call us over phone, and our team used to visit them. After that, if any medication is required, we used to have with us. We used to supply that.
The first point of contact for a rural person is the nearest block PHC and not necessarily a COVID care hospital or a center. So at each of the block PHCs, we've ensured that we've created a emergency COVID stabilization unit, which is a 2 to 10 bedded unit.
Track, test and treat at the village level. That is Assam's target with community surveillance. It has kindled hope. With camera person Sanjay Chakraborty in Kamrup district, Ratnadip, Choudhury for NDTV.